Hello, good morning, good afternoon, good evening, depending on what time this video reaches you. That's why we have sent the different salutations. So we have looked at solutions, and under solutions we looked at we have already looked at a mouthwash. And then we have looked at how double strength chloroform water can be prepared. So today we shall venture in how Linctus can be prepared, and we shall give one example of Linctus that and also how it is going to be prepared. The person speaking is Miss Atiangres, and we are broadcasting at Graphom Academy, your channel that provides you with all the necessary information that you need to pass your exams, that you need for your continuous practice at industries or at facilities like the hospitals, community pharmacies, and the rest. Okay, so I am so glad to take you through Linctus or Linctuses today. In case we get any questions along the way, please endeavor to ask them so that you don't miss out, and endeavor to at least finish the video so that you learn basics and learn a number of things. Okay, so an overview of what Linctuses are. Linctuses or Linctus are solutions of one or more medicaments, usually containing a large amount of sucrose and some glycerin as sweetening agents, and also has diluent effects on the mucous membrane of the throat. So that is what Linctuses are. They are solutions that can have more than one active pharmaceutical ingredient, and they have given us here that it has a high concentration of sucrose and glycerin, and majorly the sucrose and glycerin can be used as stabilizers or can be used as sweeteners or sweetening agents, because remember they are for internal use, so it should not give a patient discomfort when they are swallowing it. So we need a sweetening agent. We shall also need flavoring agents so that it is palatable, and the patient cannot go on a drug holiday. A drug holiday is when a patient starts the medication and in the middle they stop, and then after, when the symptoms resurface, they take the medication again. That is what we call drug holiday. Okay, so we need to avoid that discomfort, patients not complying to treatment just because of the taste of the medicine, just because of the bitter taste. So because of that, we have to mask the different bitter tastes of the pharmaceutical active ingredient by using either sweetening agents, or we can also use flavoring agents. Okay, so the vehicle syrup is soothing the sour mucous membrane of the throat, has a beneficial effect. So why we use a syrup as a vehicle, it is for it to give that soothing effect in the mucous membrane of the throat. Most of the cough conditions, most of the cough presentations, our patients present with a sour or sore throat. Okay, so for us to make a product that can handle that, we have to have a vehicle that we are going to use to be a syrup, so that it goes to tackle the presentations or the signs or how a patient is feeling uncomfortable. Okay, so when we address the things that make a patient uncomfortable, the patient gets comfortable after taking the medicine, and they will appreciate that our products are good because we tackled what they wanted to know or we gave them what they wanted to hear and what they wanted to receive. Okay, so that is why Linctus are focused on having a vehicle as a syrup so that it works on that specific discomfort in the throat. Okay, so that's why this point says the vehicle syrup is soothing the sour mucosal membrane of the throat as it is beneficial effect. Okay, so Linctuses are usually intended for use in treatment of cough, being sipped and swallowed slowly without addition of water. So encourage your patients not to add water in the Linctus, because remember, most of our Linctuses are viscous preparations, and since they are viscous preparations, they may be attempted to add water. Okay, so encourage them to sip it and swallow slowly. Why they need to swallow slowly? So that it works on the sour mucosal membrane in the throat. Okay, so whenever you're dispensing to them, encourage them to sip and swallow it slowly, not so fast. After all, it is sweet, so they can swallow it slowly. Yeah, that's why we need sweetening agents so that patients don't swallow it so fast because of the bitter taste of the active pharmaceutical ingredient. Okay, and then for local and prolonged action, they should be administered undiluted and sipped and swallowed slowly. Okay, so what are the different excipients that are used when we are preparing Linctuses? We have a vehicle, the most preferred vehicles we shall have. We have syrup, we have the tofu syrup, we have the infant syrup, we also have the glycerin, we have chloroform water, and then sorbitol, etc. So for patients who are diabetic, we prefer to use sorbitol. Those patients who have issues with the glucose, the sugar levels, and the rest, we prefer to use sorbitol instead of the syrup. So when we are preparing Linctus for a diabetic patient, our vehicle is going to be sorbitol. When we are preparing for patients who don't have history of diabetes or who do not have diabetes, we can use any other syrup. The stabilizers we need to use, we have syrups, and then coloring agents that we need to use, we have a number of them. We have what we call compound tetrazine solution, colta dyes, and then we can also use amarantha to give it a specific color. Okay, we need flavoring agents, and there are examples of flavoring agents. We have the tolu syrup, we have the fruit flavored syrup, we have the lemon syrup, we have the black currant syrup. Those are the different flavoring agents. Remember, we say that it has to be swallowed slowly. So if it has to be swallowed slowly, it should be sweet. And for it to be sweet, we need either sweetening agents or we need flavoring agents. Okay, we also need preservatives, and examples of preservatives that we shall have, we have benzoic acid is a preservative, chloroform spirit is a preservative, cinnamic acid is a preservative, and then toll syrup as well can work as our preservatives, and others that you might have read somewhere else. That's why we have put etc. There may be so many. However, we have mentioned a few from those many. So these are the different excipients that you may require when you are always dealing with Linctuses. And do not forget about sorbitol in case you are asked to prepare an extemporaneous preparation for a diabetic patient. Do not forget to put a syrup, yet you are supposed to use sorbitol as your vehicle. Okay, so we have different examples of Linctuses. We have what we call codeine Linctus or codeine phosphate Linctus. We have the methadone Linctus. We have the pediatric opiate krill Linctus. We have the full codeines Linctus. We have the simple Linctus. And then we have pediatric Linctus, and then noscapine Linctus, and so many other Linctus. These are some of the examples, but there are more than this. Okay, so we are going to look at one of them, or one of these, how it can be prepared. We may not look at all of them, but we are going to look at one, and that one is going to be our codeine phosphate Linctus. Okay. So we go to how we can prepare preparation of codeine phosphate Linctuses. Requirements. What do we need when we are preparing? What do we need to put in mind? We need codeine phosphate is acting as our active pharmaceutical ingredient. We need benzoic acid. What do you remember about benzoic acid? We said we shall use it as a preservative. We need compound tetrazine solution. It's coming in as our coloring agent. We have chloroform spirit. Remember, chloroform spirit, we say it can be used as a preservative as well, or we can use it as a co-solvent, or we can use it as they gave it to us as a vehicle, but in this specific case, we shall use it as a preservative. Lemon syrup, if you remember from that previous slide, we said lemon syrup is coming in as a flavoring agent. Okay, and then we need purified water, which is coming in to dissolve our active pharmaceutical ingredient, and then a syrup. Our syrup here is coming as our vehicle, which is our main vehicle of the preparation. Okay, so these are the different requirements. You need to know what each of them is going to be used for. Codeine phosphate, what is it going to be used for? Benzoic acid, compound tetrazine, chloroform spirit, lemon syrup, purified water, and then our syrup. So after knowing that, we need to know apparatus that we need to use. We need a measuring cylinder, we need a funnel, we need a weighing scale, we need a steering rod, we need a packaging container, and then we need a beaker. After you have identified the apparatus, you generate a working formula. Okay, like I said in the previous lectures, a working formula is generated from a master formula. So we have different reference books that give us master formulas. Okay, and we call those reference books pharmacopoeias. So we have the British pharmacopoeia, we have a United States pharmacopoeia, we have a Tanzanian pharmacopoeia, Indian pharmacopoeia. I'm not sure about whether Uganda has, but we shall confirm about it. So this working formula was already generated from a master formula. So that is why we find that in every class or in every lecture, we are going direct to the working formula. However, we are going to have a session of how we can generate a master formula from a working formula. So here we weigh solids and then we measure liquids. So when we look at our preparation, we have only one solid, that is codeine phosphate, that we are going to weigh. So we need 0.3 grams of codeine phosphate. We shall weigh 0.3 grams of codeine phosphate. We shall measure 2 mils of benzoic acid, 1 mil. Sorry about that. We shall measure 1 mil of tetrazine solution, 2 mils of chloroform spirit, lemon syrup, we are going to get 20 mils, and then purified water, we shall need 2 mils, and then a syrup should be sufficient to give us 100 mils. Procedure for preparation: dissolve codeine phosphate in purified water. So we are going to transfer our codeine phosphate in a beaker, the weighed codeine phosphate in the beaker, and then we pour the purified water and then stir to make a uniform mixture. After we have stirred, we are going to measure out the 50 ml of the syrup. So we add these 50 ml of the syrup to the above mixture. The mixture is codeine phosphate and purified water. So we stir them well to make a uniform solution. After we have done that, we shall add chloroform spirit to the above mixture and mix. Mixing is the stirring, okay? So we add our chloroform spirit 2 ml and stir. After we have done that, we add benzoic acid and stir. We add lemon syrup and stir to form a mixture, and then after that we add a coloring agent last, and our coloring agent is tartrazine solution. Okay, so we are adding all these excipients as we are stirring. Don't add all of them at once and then you are not stirring. Okay, so you make sure you are always stirring to make sure you get a uniform mixture. After you have done that, transfer the mixture to a measuring cylinder and add sufficient syrup to produce 100 ml. After we have made 100 ml, we transfer the preparation to a clean packaging material and then close properly. And that brings us to the last part of our practical always, that is label, writing a label. So the total volume of what we prepared is 100 ml. That is why here we have 100 ml. It can be at the left hand corner, or you can put it in the middle. Immediately after you have put for us the whole volume, you give the name. You write the name of what you have prepared. We write it always in capital letter and should be underlined. So we have codeine phosphate Linctus underlined. Composition, we have codeine phosphate 0.3 grams, benzoic acid 2 ml, compound tartrazine solution 1 ml, chloroform spirit 2 ml, lemon syrup 20 ml, purified water 2 ml, and then syrup sufficient to produce 100 ml. So like I said earlier on in other lectures, I said that you can write your composition the way we have put it, or you can write it in percentage concentrations. Okay, so in percentage concentrations we would have 0.3 divided by 100 times 100. That is 100%. That will give us 0.3 gram, 0.3% weight in volume, because we have grams and then this is in volume. If we have for the second one, benzoic acid will be 2% volume in volume, tartrazine 1% volume in volume, chloroform spirit 2% volume in volume, lemon syrup also will be 2% volume in volume, purified water 2% volume in volume. Sorry about chloroform, lemon syrup will be 20% volume in volume, and then our syrup sufficient to produce 100 ml. Direction for use as directed by the physician. Do not confuse the direction for use and the use of the Linctus. Linctus are always used as expectorants. Okay, direction for use. Your direction for use depends on how old the patient is, what is the weight of the patient. If it is a child, you have to give it differently. If it is an adult, and what age of the adult, and what is the weight of that adult, you also give it differently. Okay, even children, you look at what is their age, what is their weight, and then a number of things have to be put in consideration. That is why most of the time since it is a general preparation, we encourage you to include it that as directed by the physician, okay? Because we are not told of which patient to give the medicine. We have not been directed when we are preparing on which patient to give. Is it the adult, child, or elderly? Is it neonates? Something like that. So because of that, we just put a plain thing as directed by physicians. Physicians are always the ones who write prescriptions, and they give direction for use. They can say give 5 mils TDS, that is 3 times a day, BD 2 times a day. That is why we have to put it plain. However, if we are the manufacturers, we have what we shall generate a leaflet, and in that leaflet we'll have contraindications of the medicine. We shall have different side effects, adverse drug reactions that may come. We put a number of information, even direction for use. We shall be in position to give it. But in this specific case, we are doing this for study purpose and then for practice. So we just put it plain as directed by the physician. So the use of the medicine is not the direction for use. They are two different things. Okay, the use is what does the medicine treat? How does the medicine help? Okay, so how the medicine helps is for this Linctus, it is used as an expectorant. Then we have a question. The caution we give for this specific Linctus, we say should be sipped and swallowed slowly without addition of water. We make sure that our patients do not add in water there. Okay. Then storage, we encourage them to store in a cool, dry place away from children and should be protected from light. And then we allocate our product a batch number. We allocate the product a manufacturing date. We allocate it an expiry date. We allocate the manufacturer's name for this specific case, which is manufactured by Grapharm Academy Pharmaceuticals, and then manufacturer's address is Gulu, Uganda. So these are the different components of a label. And every product that we prepare, that we manufacture, be it an extemporaneous preparation or we are manufacturing it in the industry, it should carry a label. Okay, a product without a label is like it has no meaning. Like the product has no use, has no meaning, and it doesn't even get attention of the community because they cannot even know who the manufacturer is, when it was manufactured, what is the expiry date, what is the batch. Okay, so a number of things have to be put in place. So why we always need a batch number in case of any instabilities in the field, in case the product gets instabilities in the field, we are able to call back or recall. There is what we call product recall, is when a company, is when a manufacturer decides to collect all what is in the field, what is in the community, what people have already bought, collecting back and bringing it back to the manufacturing unit. So that is what we call product recall. Product recall can be done in cases of any instabilities that can be reported, in cases of any adverse drug reactions that can be reported by the community, in case of any allergies, and then instabilities, maybe storage instabilities, microbial instabilities, chemical instabilities, and physical instabilities. So those are a number of things. So you find that we are able to recall a specific batch so that we do not recall all the products. In case we didn't allocate batch numbers, we shall be forced to recall even those products that are not giving people issues. Okay, so that is why we always need to have a batch number when we are writing a label. Okay, so that is it for codeine phosphate cough Linctus. or Linctus. Thank you so much for listening.